Hi all, I am James Rajkumar, occupational therapist from Days of Joy Occupational Therapy, Vanagaram, Chennai. Myself and my wife, Divya, we are running occupational therapy clinic here for around 10 years, and we deal with children mostly with all developmental issues like autism, hyperactivity, that is ADHD, learning disability, Down syndrome, and all of the developmental issues significant for therapy. And so we come across all kind of children with severity right from mild to moderate to severe way of dysfunctions, and we deal it in multi-approach level. It's a kind of a multifunctional way so that we get a very good a quick progress in the kids in a very easy way. Like with the and we work with the parents as a team, and we believe in a holistic approach where we find betterment when worked with children along with the parents as well as the family members along with us during the therapy, because they are very significant members when comes to the kids developmental progress. Okay, so that's why we always have a team approach. We have a very clear discussions with the parents very often. We review along with the parents very frequently, and also have lot of home program modules which helps a lot in bringing up the development of the kids very soon. And we await a very quick discharge in every way in multiple approach.
What approaches do you use in OT for children with development delay?
So we use different approaches based on the specific problem in the child as per the diagnosis. And so commonly we use approaches like neurodevelopmental therapy, so called NDT, then sensory integration, then cognitive behavior therapy, including handwriting intervention, social skill training, play therapy, as well as pre-writing and handwriting skills training. So based on the necessity as per the child and at different levels. So we use different techniques as per the protocols we update every week or every month. Yeah, along with the discussion with the parents.
Can you explain about sensory integration in simple terms?
Sensory integration, the term implies like sensory and integration. So sensory in the sense like we learn from the environment through different senses. Every child starts playing, the child touch an object, feel it, how it is, grade the pressure, like the child squeeze and look how it is, and the child keeps moving the toy, how it is. Okay, so different ways the child learn from the common environment. So this is how the same issue raised when a developmental issue is there in a kid. A child fails to learn in a proper way how to feel or how to touch, how to press or how to move different objects and move self around in an environment like a park or an house. Okay, so way of learning through different senses and integrating everything together by the way of looking, by the way of hearing, by the way of touch, by the way of smell, by the way of taste. So everything matters when it comes to learning. So when there is sensory integration in a proper way in a child, naturally the child can learn easily. Whereas if the sensory integration, putting together all senses in a proper way, if it's not present, naturally the child feels difficult to learn from the environment, to walk, to talk, to play, to write, or to read, or to do any kind of thing appropriate for his or her age.
What common symptoms that you can address using sensory integration and how?
So sensory integration addresses almost all the symptoms when it comes to a child with autism, attention deficit hyperactivity disorder, or learning disability, or a Down syndrome, or motor coordination disorder, or any kind of thing which is relevant to sensory integration. That is, sensory dysfunction is present. So naturally there are symptoms, as you know, like when a child flaps the hand all time, or when a child jumps around, when a child keep running from wall to wall, or when a child looks in the corner of the eye. So these are certain easy symptoms what you have come across. So every symptom what I mentioned now is a part of different senses. So we first identify which sense this symptom belong to, whether it's a tactile or proprioceptive or a vestibular or auditory or visual or kinesthetic, or in what deeper sense it lies. And based on that, we will intervene regarding that particular symptom. It's not just a particular symptom, as a whole, as a child, what all sensory features are there. So we'll address it in that way. So simple, very simple things to say, like for example, a tactile deficit will show in the form of a laughter, emotional inappropriate way of behaviors. The child cannot read other child's emotions. The child get easily excited, easily swimming around, or easily whirling around just because a feel of self ticklishness. Okay, and the child never allow the parents or third person to touch his or her body while taking a bath or dressing up or during a haircut or a nail cut. Okay, so these comes under the part of tactile sensitivity, as you know. And proprioception, when it comes to pressure sense, the child cannot sit in a place. Okay, the child keeps lagging forward or leaning backward. The child will have a slump posture. The child cannot sit for a particular time for a for academic way or for completing a task. Okay, so that's called sitting tolerance. So we address that through sensory integration. And as well as a child who is unable to maintain eye contact, is unable to have a good name call response. There is a immediate response to a name call. So everything comes under the sensory integration. So right from the bottom to up, every symptom of a pervasive developmental disorder or autism or ADHD, so things gets covered through sensory integration. And we cover sensory integration in three phases. Yeah, so one is sensory registration, sensory modulation, and integration. So sensory registration is, for example, a child's name call response. When someone calls the child by name, the child never responds, never even act like heard about it. The child will keep playing, continue with what the child is doing. So that's a registration itself is absent. But whereas when the registration has happened, the child shows at least a little bit of movement, a jerk, at least, okay, have a look, but doesn't listen and turn to the person who called the name. So when it comes to modulation, naturally this is the thing, like modulation is something the child over responds or under responds. The child would have heard the name so louder that the child never responds. Sometimes the child would have never heard it at all. So in that way the child never responds also. So under responsive or over responsive is another thing. And finally, once everything gets modulated, then the child can simply, when the child is having sensory integration in a proper way, naturally the child can immediately turn to whoever is calling. So that's finally the end product of the name call response. The child turns to the person. So where the initially registration, then modulation, and then integration, three things should go in order, finally settle down. Naturally, the child can respond. So same way for everything, right from a child who is scared of heights, the child refused to go to a park just because there is a swing, there is a slide, he want to climb up and he want to play on a height. The things keep moving, a swing keeps moving, merry-go-round keep rotating. So the child is scared of heights. So for in that case, so that means that that particular part of the brain which processes this vestibular system, there is a movement sense of the body, is not adequate and it's having a dysfunction. So naturally we deal that symptom to be particular and we train that child to get rid of that fear of height and movement. So this gives a way finally integrating the sense, and finally the child keeps integrating, and finally the child keeps the proper development as per required. So this wise, so every senses need to be integrated properly. It's like a balance. So some on the top and some on the bottom. We need to bring everything to a neutral line so that every sense is put together function in a same way, same speed, same rate, and same kind of frequency, everything put together, finally the child can easily function in a good way. For example, just to ride a bicycle, we need all senses put together. The child need to look straight, the child need to listen to a horn sound from behind, the child need to pedal the cycle with the legs, child need to hold the handle with the hands, and in addition, the child needs a proper sitting posture, the trunk need to be erect. So every senses put together finally gives rise to a function called bicycling. The same way for writing or for any other play, a simple play or any kind of task. So the child needs sensory integration in a proper way. So every symptom when gets settled down, finally naturally the child gets a proper independent function.
How quickly you can observe changes in child's development if we follow proper OT exercises.
Yes. So the progress of every child is very specific. It's dependent on age, the first part. When it comes to early intervention, that's below 3 years, very commonly said. So that's very quick progress we can observe. The reason is multi-way. The child is the brain getting evolved. The brain is not yet fully developed. The myelination we call, there is a nerve fibers. It's not yet fulfilled, and hence we can mold the brain as per our wish. Okay, it's called a plasticity of the brain. So naturally we can achieve the very good progress as early we start with our therapy. And there is a baseline they call as the 5 years. The 5 years is a question every parent usually asks: what happens after 5 years? What is before and after 5 years? Naturally, the very clear explanation is the part of ego development, that is a psycho emotional development. The ego sets very quick during the age of 5, whereas the child will decide for himself whether I need to do it or not. The decision is left to the child when it comes to age 5. So the child behaviorally responds in a negative way certain time, okay, and in addition certain unfavorable factors where there is encouraging factors for the child to take the behavior higher and higher, getting worse. So in that way it affects the development. So age wise this is one factor, and the other factor is severity of the child, whether it's mild, moderate or severe in symptom or in the as per the diagnosis. So based on that, the improvement, usually the progress when a child comes to us, so we can guess, yeah, the child can improve even within 3 months. Yeah, the child may get discharged. Okay, a high functioning child, and certain kids they may need 6 months to 1 year, yeah, or maximum of around 2 years in according with the exact symptoms, the overall the total thing of the child when we start assessing the child. Yeah. Yes. So dietary intervention is something a new approach, though it's not very new, but yet to be followed by the parents, or to be advised to the parents. Yeah, it's a very important intervention. We call it as the very base and the foundation behind occupational therapy, though it's not very principally addressed to the parents in a proper way. But still, what we does here is based on the symptom of every child during the assessment, we say certain dietary intervention programs, yeah, which will not affect the child in any way, but at the same time it brings a lot of progress in a very quick way when done parallel along with the sensory integration and other developmental therapies in OT. Yeah, so diet intervention, the link between that and sensory integration. See, almost everything we call as brain behind the sensory integration or autism or ADHD or learning disability. But there is something else to know. There is a gut system, the gastrointestinal system, our digestive system. There's a very principal thing. It's called the second brain. Okay. So why it's called second brain is everything, the behaviors or sensory things, whatever the child expresses out, it's principally the very basic foundation. The part is what diet the child consumes. If the child eats this, he behaves this way. If the child eats that, the child behaves that way. So everything is correlating. The sensory signs as well as the diet is very directly correlated.